So I had the surgery, and after that, that's kind of where things took a turn for the worse for me. Hey, if you are returning, welcome back. If you're new here, hi, my name is Tamara. Thank you so much for clicking my video. I hope you stick around. Let's jump right into today's topic. We are going to be talking about hidradenitis suppurativa. If you don't know what that is, hidradenitis suppurativa, or HS, is an autoimmune skin disease that causes reoccurring boils, lumps, bumps, abscesses, and cysts to grow in the areas such as the underarms, under the breast, in the groin, and on the butt. It can appear to grow in other places, however, those are the most common places. I wanted to just shed a light on HS, and I also wanted to share a little bit about my story and my experience dealing with this disease. My story begins back in the summer of 2022. I was diagnosed with HS after being seen by two different dermatologists and having, I believe, a total of 4 different visits. Since then, and to this day, I still have been in denial about it. Um, the idea that I have an autoimmune disease that is incurable and just decided to rear its head in the middle of my 20s, it just hasn't sat right with me. And it's been difficult dealing with the disease and then also dealing with the denial that I feel. I find myself just endlessly Googling and searching and looking for answers when I already have the answer. So it really takes a toll on me. When I got diagnosed initially, I only had one uh, lesion, which was under my right arm. It started out what seemed like an ingrown hair, and then it just continued to stay. And sometimes it would be inflamed, sometimes it wasn't. But I wound up having like pain, like very untolerable pain coursing through my whole arm. And I was like, okay, it's time to get this looked at because that shouldn't happen over no little ingrown hair. And mind you, it had been a while, so it was pretty obvious that it wasn't just an ingrown hair at that point. But for so long, I put off my health for the sake of taking care of, my kids and being there for my husband. If it doesn't seem serious, I typically just brush it off to the side when it comes to me. It has to be something that seems like my life is going to end today in order for me to go see the doctor. And that's horrible, honestly, because it's not like I don't have the means to go to the doctor. I just don't. And I wasn't. I will say I wasn't, because we're changing that, but I wasn't prioritizing myself. And I mentioned that in my previous video. So if you haven't gone to take a look at that, go check that out. Anyway, so after I got diagnosed, several months after, leading into 2023, I had a couple more lesions appear in my inner thigh area. I had developed a pilonidal cyst, which that is typically a cyst that occurs like at the top of your butt crack. Can be very painful. And I had also developed some abscesses that were on my butt, also very painful. At this time, I had made trips back and forth to the dermatologist. I won't say a whole bunch, but I had made a few. I had been given uh, antibiotics to try to see if that would help relieve my symptoms. I had also been presented with the option to have surgery, and I believe at that time I had also been presented with the option to start Humira. Because of the denial I was in, and still am, it was hard for me to make a decision because none of that felt right. Nothing felt like the solution because I was like, you guys are treating the wrong thing. I don't have that. I don't have HS. I don't know what's going on with me, but that's not what I have. And the options that you're giving me are not options for me because I don't have that. And that's basically what I was dealing with mentally. I didn't ever settle on, trying any real treatment options outside of taking the antibiotics here and there, but I wasn't consistent with it. Going into the summer of 2023, I had decided I was going to have surgery done to help with the area under my arm. It wasn't necessarily getting worse, but it also wasn't getting better either. There were times where it was more inflamed than others, but like I said, it wasn't necessarily getting worse. And so I was like, okay, well, maybe we can try the surgery. So I had the surgery, and after that, that's kind of where things took a turn for the worse for me. I had, within a couple of days, had developed abscesses. I was experiencing fever and chills, and I was for sure I had an infection going on. I went to the doctor because I had a follow-up visit, and she prescribed me a couple of more antibiotics, clindamycin and rifampin. She had prescribed it for a long-term treatment, so I believe it was like 10 weeks. I did 30 days of the treatment and then ran into some other issues, and I did see some improvement. However, within a couple of weeks of stopping the antibiotics, things just went right back and progressively have gotten worse since then. I now have developed ulcers all underneath my stomach, all within my bikini line. There's just a lot going on, and I've been experiencing so much discomfort, and it's been hard. It's been really hard. I wound up going to my primary care doctor just to see if there was anything else that I had going on that was getting in the way of my skin healing and getting better. I was just like, this is horrible. At this point, it was taking such a toll on me physically, emotionally. Like, I was so, I can't even say was because I'm still very self-conscious about it. Um, I will say I'm not depressed. I do get sad about it, and I do get in my feelings. I do get emotional about it just because when I look at my skin, or if I'm experiencing pain, which I am most of the time, if not all the time, I just get emotional about it. For anybody who is dealing with HS, I know that you're experiencing the same things: the pain, the depression, the emotional stress, the mental toll that it takes from you, how it makes you feel about your body. It's a lot. It's a lot. I wanted to share some ways that I have been coping, especially these last few months where things have been the worst they have been, in hopes that maybe it'll help someone else. I have struggled in the past with anxiety and depression. However, since starting my journey and my walk with God, that has dramatically changed and it has dramatically improved. I will say, like, there are times where, it creeps up on me, but my faith in God at this point is way too strong to really let it take a hold of me like it has in the past. One of the main things that really works for me is prayer. There has been countless times where I've been in the bed crying and pouring my heart out to God and just asking him to hold my hand through this journey, because this isn't something that I can handle on my own. This is not something that you can handle on your own. And when it comes to things like this, That's what he asks us to do. He asks us to leave our burdens at his feet. We're not meant to carry it all. So go in prayer and give it to God. One of the other things that really works for me is just taking it one day at a time. My pain levels vary from day to day. My emotional state varies from day to day. So I kind of just take the day as it comes to me. I don't try to dwell on what I felt like yesterday. I don't try to let what I may feel like tomorrow affect my current day, affect the current moment, because it's just not helpful. If I wake up that morning and I am feeling extra down, my pain levels are through the roof, my emotions are in the dump, I pray and I say, God, give me the strength to get through this day. Get done what absolutely needs to get done and then rest from there on out. That's just the reality. Some days I just don't have it in me to do any more than the bare minimum. And I've come to learn that that is okay and it has to be okay. If there's a day I wake up, I'm feeling good and I'm not in that much pain, emotionally I'm okay, I just thank God for that. And I still ask him to help carry me through the day. I still ask him to help me to be productive, help me to get moving through this. And I ask him to help me not think about like, oh, if I start doing this then the pain might increase or whatever. No, I just get done when I need to get done, and I try not to overexert myself in the process so that I don't experience extreme amounts of pain. Another important thing would be to have support. Have at least one person that you can talk to about what it is that you're going through. Even though they might not be able to relate, they might be able to be there for you and help to pick up where you're not able to carry yourself in the moment. It's okay to ask for help. It's okay to need the help. And I know you may feel embarrassed. I know you may feel ashamed, but don't. And having the right people around you to support you, they won't make you feel like that anyway. Talk about it, ask for help, don't suffer in silence. And if you have absolutely nobody you can go to, you can come to me. And that's honest, that's genuine. Like I'm here. Okay? All right. See you later. If you have HS or if you think you have HS, then you probably know by now that the disease is not curable. And if you don't, well, now you know. Where does that leave us, though, with options as far as treatment? Well, let me share some with you. These are options that have been presented to me by my dermatologist, and I wanted to share them because it took a while for me to be presented with all of these options that are available. Keep in mind that some options might not be as effective depending on what stage your HS is in, but be sure to do your research, talk with your dermatologist about your options, and see what is best for you in your current stage of HS. We have steroid injections, which is exactly what it sounds like. It's an injection of steroids directly at the site, which can help to reduce inflammation and calm an area down. This will typically be for your beginning stages of HS. If you have advanced HS, this is probably not the best option. Then we have antibiotics. Antibiotics can be given for a long term, such as the one like I had mentioned my doctor prescribed to me. I have been prescribed doxycycline and clindamycin and rifampin together as an antibiotic treatment. Depending on what's going on with your HS, this could be a good option. As far as me right now, I am going to restart an antibiotic treatment just because I was seeing improvement when I was on the treatment the first time. However, again, it varies. This may or may not be a good option for you. Then we have biologics such as Humira. There's also another one that my dermatologist was recently talking to me about, but I can't quite remember the name. So typically, this is going to be a lifelong treatment option. In some cases, people are able to be on it for a few months. What? And can get off of Humira and their HS will still remain in remission. In some cases, they will get off HS, not get off HS, they will get off Humira and their HS will flare right back up. So again, it's something to think about, something to weigh the pros and cons of, and to talk to your doctor about. Another option would be to have surgery. Now, you can have an in office procedure done with local anesthetic, which is what I had, where they basically just went in, kind of removed the dead tissue, the scar tissue, to help promote the growth of healthy new tissue. Then you can also have a surgery that's done in an operating room where they put you under general anesthesia, and typically it's either going to be performed by a general surgeon, or it would be better if it was performed by probably a plastic surgeon who specializes in HS, because they kind of know they know a little bit more. Last but certainly not least, and this definitely to me isn't really an option, but making lifestyle changes. Dealing with an autoimmune disease, typically there are going to be lifestyle changes that you're going to have to make in order to live comfortably with your disease. That will include making diet changes. So, in some cases, the things that we're eating could be flaring up our HS. So, you might have to cut certain things out, or you might have to add more of something into your diet. Exercising help to increase the circulation in your body. Also, if you are overweight, making an effort to lose the weight. I'm currently 20 pounds down from my starting weight of like 250, 254, around, I want to say this time last year. I have not been consistent with my weight loss up until more so recently, but it's definitely something that I have been working on, because things rub together a little bit more when you got a little bit more weight, when you got a little bit more, stuff going on. And the friction does not help. Okay? It doesn't help. So that is something to work on, and it's easier said than done. And also for me personally, I've been focused more on my diet and trying to make changes there, because exercising just isn't in the it's not in the what what's this, how the saying go, it's not in I can't exercise right now. Simple as that. Physically, I just can't. So, although I'm hoping that once I restart my antibiotic treatment, I will be able to get back into exercise. I said get back into, that's crazy. I wasn't exercising before. Let me not. Mm-mm. Hopefully, I can get into exercising once those antibiotics kick in and I start to get some relief from that. Another point I want to touch on when it comes to making lifestyle changes is your overall health. A lot of times, people with HS have an underlying disease that exacerbates their condition of HS. So, getting to your primary care doctor, getting the test done, running through your symptoms, getting the blood work, doing all the things, just making sure there isn't anything else that is tag teaming your body and trying to take you out. That is one of the steps that I have taken. And I found out that I have quite a few deficiencies as far as like my vitamins go. My stress levels are high. My thyroid is not functioning properly. Having this disease, it made sense to me to go and see what else was standing in the way of me going into remission. With all that being said, please remember to do your research when it comes to what your options are and try to pick the options that is best for you. Okay? Really dig into it, really think about it, and really work on making those lifestyle changes, because all those other options are only temporary band-aids to the situation. It is very possible with any of those other options for your HS to rear its head again. So that's why I said making lifestyle changes is kind of really not an option. There's been so many people that have been able to send their HS in remission just based off of diet changes alone. I definitely want to give all the glory to God for being able to even put me in a position to use my situation, to use my experience to potentially help others. I know for a while I was questioning, well, why this was happening to me, and I felt so I don't know what it I really don't know how to put into words what it was that I felt, but I just didn't understand like why all of a sudden this was happening to me. What am I supposed to do with this? How am I supposed to function with this? How? Why? Those questions that I had, and I took them to God. And if you are in that same place, I urge you to pray and talk to God about it. I have a few scriptures hanging up on my bedside wall, and I want to share with you one of them that had kind of led me to, you know, asking God what was up. James chapter 1, verse 5 says, "If you need wisdom, ask our generous God, and he will give it to you. He will not rebuke you for asking." For me personally, I grew up feeling like I couldn't question God. I couldn't ask him why things were going a certain way. But I feel like reading that scripture, it says otherwise. I didn't ask him coming from a place of arrogance. I didn't ask him coming from a place of being prideful. It was literally like, I just want to know what's going on. Truthfully, I felt like it was revealed to me why this was happening. I urge you to do the same. Really press, really dig in, fast if you have to, and seek those answers that you're so longing for from God. He would love to hear from you. If you reached the end of this video, thank you so much for tuning in. If you have any questions for me, if there was anything I didn't cover in this video that you would like more information on, please don't hesitate to leave your questions in the comments below. If you haven't already, hit that like button, hit the subscribe button, and again, thank you so much for watching. I will see you in the next video.